All right. Welcome everybody to the COVID-19 education session for children ages 5 to 11. My name is Eve. I am the drug strategy coordinator here in Six Nations. I've been here for about almost 2 years actually. And I've been helping out with a lot of the COVID-19 efforts, including a lot of education and awareness, such as the vaccine education sessions that we did for adults back in May, and now currently the ones that we're doing today. So what we're going to be going over today is our agenda for today basically is we're going to start off with some COVID-19 myth busting that will be followed by how to handle any type of misinformation and what we know about the vaccines for children. Safety and or side effects that could occur as a result of the vaccine, as well as the Omicron variant. All right. So with the COVID-19 myths, some of the most common myths that we're going to hear, and I'm just going to cover some of the most common myths that we hear. So one of the most common myths that I've heard is, if I've had COVID-19, I don't need the vaccine. Well, the evidence does continue to indicate that getting a COVID-19 vaccine is the best protection against getting COVID-19, whether you've had COVID-19 or not. There are several studies that indicate that if you have had COVID-19 before and if you are not vaccinated, your risk of getting reinfected is more than 2 times higher than those who were infected and got vaccinated. So yes, while there is evidence that there is some level of immunity for those who previously had COVID, it is not known how long you were protected from getting COVID-19 again. Plus, the level of immunity provided by the vaccines after having COVID-19 is higher than the level of immunity for those who had COVID but were subsequently not vaccinated. So getting vaccinated provides a better and a greater protection to others since the vaccine helps reduce the spread of COVID-19. What about the children's vaccine was rushed? Well, it is natural for parents to have questions about the speed that the COVID-19 vaccine development and as well as the potential for longer term side effects in their children, especially if you're thinking about what happened with thalidomide back in the 50s and 60s. The good news is that the COVID-19 vaccines from Pfizer and Moderna were created with a method that has been in development for years. So the companies could start the vaccine development process early in the pandemic. The vaccine developers didn't skip any testing steps, but conducted some of the steps on an overlapping schedule to gather the data faster. So by that, I mean, usually there's 3 stages of vaccine development, and they did those all at the same time. The biggest reasons why the vaccines take so long is funding, but because COVID-19 is so contagious and it was everywhere, the government invested heavily and paid for research well in advance, which allowed scientists to speed up that research process. As well, because COVID-19 again was so contagious and widespread, it didn't take long to see if the vaccine worked for the study volunteers who were vaccinated. And as well, social media really helped companies find and engage study volunteers, and many were willing to help with the COVID-19 research. So why shouldn't we really shouldn't vaccinate kids? Because they never get quote unquote that sick. Well, the risk of kids getting COVID-19 is not zero. There are highly transmissible variants like the Delta and recently the Omicron that are contributing to this change. Kids are making up an increasing proportion of the total cases recently, and they are just as likely to get infected as adults, and some kids can get seriously sick. About 1/3 of the people who become hospitalized, the kids who become hospitalized, don't actually usually have any underlying medical conditions. And kids can also develop a variety of short and long-term health issues from COVID-19, such as multi-system inflammatory syndrome and long COVID-19, which we will get into in a few slides. The vaccine is safe and effective, and it is very high quality. All right, next myth is, I'm not going to get the vaccine because it will affect my fertility. Well, the COVID-19 will not affect fertility. Confusion arose when a false report surfaced on social media saying that the spike content on this coronavirus was the same as another spike protein called syncytin-1, and that is involved in the growth and the attachment of the placenta during pregnancy. The false report stated that getting the COVID-19 vaccine would cause a woman's body to fight this different spike protein and affect her fertility. This is completely different and distinct. The two spike proteins are completely different and distinct, and getting the COVID-19 vaccine won't affect the fertility of women who are seeking to become pregnant, including those in vitro fertilization. We have a lot of really good real-life data from women over the year. So our real-world data shows that people who have been getting vaccinated with COVID-19 vaccines have had safe and successful pregnancies, and this includes 500 people in Ontario as of May 2021 who have disclosed that they've gotten the vaccine and have since gotten pregnant. Data also shows that in IVF, patients' vaccinations doesn't affect any ovarian function, egg quality, or fertilization or clinical pregnancy rates. And the last myth, well, I'm healthy, I don't need a vaccine. Well, think of the vaccine as an added level of protection. Having a strong immune system may help you from serious or fatal outcomes if you do get the disease. And we're also seeing many young and healthy people who are still ending up on ventilators or with serious long-term brain, heart, and lung damage. So getting the vaccine is an added level of protection that you should have in addition to a healthy lifestyle, such as good food, vitamins, sleep, and exercise, plus having our bodies know how to fight it off. And as we know, COVID-19 is a new coronavirus and it keeps getting into variants, meaning our bodies don't know how to fight it off. And the vaccine's role is to teach our bodies how to fight it off if it encounters it. So speaking of myths, we find that oftentimes media sensationalizes stories and stretches the truth to make the stories seem worse than they are. There is a lot of misinformation that is going around, and it can be quite confusing and quite overwhelming to know what information you can trust and what information is wrong. Social media sites such as Facebook are known to propagate fake news stories and conspiracy theories. So we have to be extremely critical of anything you find on social media. So how can we spot fake news? Well, consider the news source. Is it from a trusted news site like CBC? Or is it information that you are reading in a blog? Read beyond the headlines, as headlines are meant to capture our attention. But they often don't tell the entire story until you read the full article. As well, check the author to see if they're real. What other types of articles are they writing? Is it satire, or are they verified journalists and bloggers? Sometimes if the articles seem too far-fetched, check to see if it is satire, as some websites like the Beaverton, are known to post stories that look real but are a joke. And when in doubt, ask the experts, such as your healthcare provider, or consult some of the resources that we have in this next slide. So this slide that we have here are sources where we got all of our information from. The following sources have web content that is written and researched and also approved by subject matter experts, including physicians, researchers, epidemiologists, and analysts. The content is based on peer-reviewed science, meaning that it has been double-checked to ensure accuracy by many people in the research field before it is published to the public. As the information on COVID-19 is rapidly changing, these resources are most frequently updated to provide you with the most up-to-date information. So what do we know about the COVID-19 vaccine in children? So we know this. In September 20th, Pfizer says that its vaccine is safe and effective for children ages 5 to 11. A month later, in October 18, Pfizer then submits its data to Health Canada for approval. A month later, Health Canada approves the Pfizer vaccine for children ages 5 to 11. Then a few days later, the Ontario Ministry of Health announces that children ages 5 to 11 are eligible to be vaccinated. Then the next day, children ages 5 to 11 can start booking vaccines to get vaccinated. And the great news is, as of Friday, November 26th, children have been able to get vaccinated at our mass vaccine clinic, which is at the Joe, and after January, which will be back at Oswego Public Health. So when we look at COVID-19 in children, we know that they have mostly been spared from the direct effects of COVID-19. Their infection rates are lower than in adults, and most affected children have little to no symptoms. In Canada, about 21% of the COVID-19 cases have been reported in people under 19 years old. In ages 5 to 11, the COVID-19 cases represent about 7.5% and about 0.3% of hospitalizations and ICU admissions. In Ontario, this would look the same at around 70,000 cases of COVID-19 in ages 0 to 4, 31,000 in ages 5 to 11, with 2 deaths and 1 death respective in each age category. So we are seeing here, while children have mild symptoms, they are just as likely as adults to get COVID-19. And as well, some children do require hospitalizations and some have severe disease, including children with underlying medical conditions that could be at increased risk of severe COVID-19. And recently, children ages 5 to 11 have been having increased rates of COVID-19, although their rates of hospitalizations thankfully have remained low. And even though younger children are less likely to experience serious cases, they can transmit COVID-19 to other people. So having access to a safe and effective vaccine will help control diseases spread to the family and friends, some of whom may be at higher risk of complications. So when we talk about some of the complications that could happen when kids contract COVID-19, one of them is they could be at risk of developing multi-system inflammatory syndrome, also known as MIS-C. So MIS-C in children is a condition where different body parts can become inflamed, including the heart, lungs, kidneys, brains, skin, eyes, and gastrointestinal organs. Symptoms can include fever that lasts longer than 24 hours, as well as vomiting, diarrhea, skin rash. They could be feeling quite fatigued, and they could have a fast heartbeat or rapid breathing. We don't yet know what causes MIS-C, but we do know that many children with MIS-C have been infected with COVID-19 or have been around someone with COVID-19. MIS-C can be really serious and even deadly, but the good news is that most children who are diagnosed with this condition have gotten better with medical care. As well, in Canada, about 272 cases of MIS-C in individuals 0 to 19 years of age have been reported. The average age was 6, with 40% of cases occurring in children ages 5 to 11. Thankfully, most of the cases of MIS-C recover, and no MIS-C associated deaths have been reported in Canada to date. When we talk about another complication of COVID-19 that could happen, could be long COVID, or what people call long hauler syndrome. And this could happen even if people have mild and or little to no symptoms. And long COVID or long hauler syndrome are a wide range of new and returning or ongoing health problems that people can experience to 4 or more weeks after being infected with the virus that causes COVID-19. Long COVID does appear to be less common in children than in adults. However, in a study in the UK found that 7 to 8% of kids reported having symptoms after 12 weeks. The most common symptoms included fatigue, headache, insomnia, trouble concentrating, muscle and joint pain, as well as a cough. All of these things could impact their quality of life, as they might have a hard time getting back to their daily activities such as school, sports, and other part of their lives, and could be quite distressing to have an extended amount of symptoms for a long time. So here is where that Pfizer vaccine comes in. So is it safe for children? Yes, it is absolutely safe for children. 2 doses provides 90.7% protection against symptomatic COVID-19, including the Delta variant. This vaccine for children does have a smaller dose than for those age 12 and older. This is because healthy children have a strong immune response compared to youth and adults. So by this, I mean that children below the ages of 11 have a much robust immune response compared to those older. So during the trial, scientists wanted to see if they could use a lower dose while providing the same protection and less side effects for children. So in the clinical trials, Pfizer studied 1,500 children who received the vaccine and 750 who received the placebo, which is a vaccine that doesn't have the actual medicinal effects. And then they followed them for a minimum of 2 months. Then what they found was that a lower dose provided children with very good protection against COVID-19 while only having mild side effects. So that means that for a lot of kids, it doesn't matter on their weight and height, it's by immune response. So our immune systems are most effective at this age, and then they tend to peak at about when you're 15 years of age, and then they kind of just taper off for a little bit until you're older. So that's why they suggest the smaller doses for children that are below age 11 and below. And so far, about 23% of the population in Ontario have gotten the vaccine, and no serious side effects have been reported. The most common side effects that were reported is pain at the injection site and some fatigue. So children, like adults, may experience side effects after receiving the vaccine. And most side effects are mild and they're easily tolerated. The side effects are different for every person. So you might notice some tenderness or pain where the vaccine was given in the upper arm, or you could feel more tired than usual. Headaches, achy muscles, or joints and fevers and chills are also possible. These side effects are usually temporary and they tend to clear up within 1 to 3 days. They're also a positive sign that the vaccine is beginning to work. Again, the side effects will be different for everybody. So just in case somebody gets pain at the injection site, doesn't mean that's going to be the side effect for everybody. So serious side effects could occur, but they are extremely rare. So symptoms do include hives, trouble breathing, swelling to the rash face and throat, a rash or a high fever over 40 C, convulsions or seizures, and pins or needles and hums. These are abnormal and they typically present within 15 to 30 minutes after receiving the vaccine. So this is why there is a 15-minute observation period after the vaccine. However, at Oswego Public Health and Dejo, there are nurses and a physician on site at every clinic, so you will be in good hands if anything does happen. So you might have heard this over the news regarding heart inflammation as a side effect in children who receive the vaccine. So Health Canada and the CDC have reported very mild cases of heart inflammation, also known as myocarditis or pericarditis in adolescents and young adults. However, the majority of these cases are mild and they resolve quickly, and the cases most occurred frequently in teenage males ages 16 to 30 after their second dose. So it is very reasonable to predict that post-vaccination myocarditis rates are going to be very low in children ages 5 to 11. However, it's not clear whether these infections are caused by the vaccines or the infections caused by COVID-19, as myocarditis is typically associated with injury or viral infections such as the flu or COVID-19. And this is because the risk of myocarditis is almost 16 times higher in people with COVID compared to those who aren't infected. The myocarditis risk is also 37 times higher for infected children under 16 years of age, or infected children between the ages of 16 to 39, compared to their uninfected peers. So we do see here that the benefits continue to outweigh the risks when it comes to the vaccines. So we still highly recommend the vaccines. However, you should seek immediate medical attention if your child complains of chest pain or feelings of tightness or shortness of breath or heart palpitations or irregular heartbeat after receiving the vaccine. So who can get the vaccine? Well, the vaccine is safe for most children, including those who have any type of allergies to any food, latex, or any type of medication. if they have asthma, if they have any type of underlying health conditions, as well as if they have had a previous COVID-19 infection, as long as their symptoms have resolved and they have been cleared by public health. Who can't get the vaccine? Well, if you're allergic to any of the ingredients in the vaccine, such as polyethylene glycol, as well if you've had an immediate or delayed severe reaction to the vaccine, if you've had anaphylaxis to a previous dose of the vaccine, if you currently still have COVID-19 or you're still in isolation, you do have to be cleared by Oswego Public Health or your public health unit before you can come and get vaccinated. And as well, this is specifically for children. If you've had any other vaccine within the last 14 days of getting the COVID-19 vaccine, you have to wait at least 14 days before you get the COVID-19 vaccine. So the Omicron variant, well, what we know. Well, this was discovered in South Africa on November 24th, and this variant has a large number of mutations, which is concerning. There is some preliminary evidence that suggests an increased risk of reinfection with this variant as compared to other variants of concern. About 11 cases have been confirmed in Ontario, and as a result, Canada has enhanced border measures for all travelers who have been in the South Africa region for the last 14 days. As well, because it's so new, we're really unsure of what it can do. However, so far, the CDC does state that the Omicron variant will likely spread more easily than the original SARS virus. However, how easily the Omicron spreads compared to Delta is unknown. As well, will the Omicron variant cause more severe illness? We don't know yet, as more studies are needed. However, early data has found increasing rates of hospitalization in South Africa. However, this could also be due to the increasing cases of overall cases, because their cases have been rising quite frequently there, as well as everywhere else, including here. Hospitalizations and deaths and the after effects usually take weeks to develop, so there's always a lag in reporting. And that's because it'll take a while for somebody to get sick, and then for somebody to get so sick that they need to be hospitalized. So that's why this data usually takes about a few weeks to a couple of months to figure out. So more data is needed to know if Omicron infections and specifically reinfections and breakthroughs are happening in people who are vaccinated, or if they cause more severe illness or death than in other variants. And will the vaccines work against Omicron? So current vaccines are expected to work against severe illness and hospitalizations. As of this morning, I believe Pfizer has come out with a statement saying that their booster shot just does work against the Omicron variant. However, to what extent it could erode our immunity, we don't yet know. And we also don't yet know if breakthrough infections could happen in people who are fully vaccinated. So what can we do to protect ourselves from the Omicron variant? Well, as we know, vaccines do remain the best public health measure to protect people from COVID-19, slow transmission, and reduce the likelihood of new variants emerging. This means getting 2 doses of the vaccine and getting a booster shot 6 months after your second shot. The Delta is still the dominant variant in Canada, and vaccines are still highly effective at preventing disease. Vaccines are also highly effective at preventing severe illness, hospitalizations, and deaths, and scientists are currently investigating to see how protected fully vaccinated people are against infection, hospitalizations, and death. As well, we do know that masks offer protections against all variants, and we continue to recommend wearing a mask in public settings, in indoor settings, or in areas of really high community transmission, regardless of your vaccination status. And as well, testing. So tests can tell you if you are currently infected with COVID-19. Testing is also important in helping the spread of COVID-19, as testing is the only way we confirm if you have COVID-19, and knowing that you're infected is important to protect yourself and your family and the people that you encounter. And remember the layers of protection: physical distancing, masking, improved ventilation, hand washing, and vaccines are all parts of the tools that we can help in preventing ourselves from getting sick with COVID-19. So why should we vaccinate our kids? Well, one, the vaccine helps prevent kids from getting COVID-19. And as I said before, even though it is milder than it is in adults, some kids can get severe lung infections. They could be quite sick and require hospitalizations. They could also get complications such as long COVID or multi-system inflammatory syndrome. And that could require intensive care and long-lasting symptoms. And the vaccine also helps prevent and reduce the spread of COVID-19. And just like adults, we know that children can transmit coronavirus to others if they're infected. So even when they have no symptoms. So getting that COVID-19 vaccine can protect children and others in reducing the chance that they transmit the virus to others, including family members, friends, and elders who may be more susceptible to severe consequences of getting the infection. As well, getting vaccinated can help stop other variants from emerging. Since the beginning of the pandemic, COVID-19 has mutated, as we've seen, the Alpha, the Delta, the Omicron variant. These transmissions provide a chance for the virus to mutate further and to create a new variant that could prove more infectious or resistant to the available vaccines. So reducing viral transmission by getting vaccinated also reduces the virus's chance mutate into any more new variants. However, incomplete vaccination, so not getting your second shot, does give variants a chance to emerge. And as well, vaccines help protect our community. So another reason to strongly consider a COVID-19 vaccine for your child is to protect the health of those living and working in your area. Having more young people get vaccinated helps us protect our families and our entire community. And getting our vaccinations will mean that we can start going back to the things we love, like sports, volunteering, having dining in restaurants at full capacity, and going back to school. And one of the last things I want to leave you with is getting vaccinated is a choice that you and your family can make, and it plays an important role in helping you protect yourself and your friends and your family and your community. So speaking of this, I did want to bring out my colleague, Sarah, as getting vaccinated is a choice as a parent. And I just wanted to get Sarah's story on why she decided to get your children vaccinated. So you have these two kids here who got vaccinated. And how did you decide to get them vaccinated? What was the process that you went through in your mind to get them vaccinated?
Yeah, sure. So really it comes down to, came down to looking at what are the costs of not vaccinating our kids versus what are the costs to vaccinate. And, I'm an epidemiologist at Health Services. I have worked within this pandemic for over the last year. So I have been following vaccinations quite closely. In addition, we have had COVID-19, so we know what it feels like. We know what it's like to have COVID-19. Both of our kids have had it. So when considering that, we considered our experiences and how it affected us when we had the virus, but also we thought about our family, wanting to protect our family and the unknown about any additional variants and how that might affect them if they came in contact. Then we looked at, okay, what are the costs of vaccination? There is the concern regarding myocarditis, but when we looked at how rare that does occur versus the benefits of getting vaccinated, it definitely leaned more towards more benefits towards vaccination, and that's how we made our decision around that.
All right, thanks, Sarah. What were their reactions? Were they scared about getting vaccinated, or were they excited, or a bit of both?
So we had let them know that this was coming for quite some time. So we had been letting them know what the process is like. They have had other vaccines before, so they're decently familiar. prior to getting vaccinated, they weren't really fearful, but as you can see, they're quite young. So one's 8, our oldest, and our youngest is 5. So they were both a little fearful when they actually sat down to get vaccinated, but there was really helpful staff there. There was also a lot of child-friendly decorations that we were able to distract them with. So that definitely helped a lot.
All right. What did they have any type of side effects or anything, or yeah?
Yeah, so right after they received the vaccine, the oldest, he was fine. The youngest was a little bit teary-eyed. He didn't like the feeling of the needle, but the next day they actually didn't have any side effects. So they didn't even complain of a sore arm. So I'm jealous of their experience, but
Nice. And were the nurses there really good at helping some kids who might be a little nervous about getting their vaccines or might be a little hesitant?
yeah, the nurses were really great with them. They also helped me in distracting them. I was able to sit my youngest on my lap to provide him more comfort. So yeah, it was a pretty good experience.
Well, thanks so much, Sarah, for your experience with that. And I did want to let people know where they could get vaccinated. You could get your children vaccinated at the Joe. That's where we're having our vaccine clinics from now, Mondays to Thursdays until December 23rd. And you can also go to Brantford and Hamilton, Haldimand, Norfolk, wherever you live. And as well, I believe that Sarah wanted to say one more thing about a study that they are needing participants for.
Yeah, so anyone watching, if you have received your vaccine or if you have not received your vaccine, we're currently recruiting participants for a study. It's called the COVID Community Study. So we're looking at the effectiveness and safety of the vaccine over time, as well as how the pandemic has impacted the community, both mentally and emotionally. So again, whether you've received your vaccine or not, you're able to participate as long as you are 18 years or older and identify as a First Nations individual. Participation would include 2 visits to White Pines, where you would complete a questionnaire and provide a dried blood spot sample. And the dried blood spot sample is similar to getting your blood sugar tested. So it's just a quick poke to your finger. To me, it feels like a rubber band hitting your finger, and you put your droplets of blood on a card, and that can be used to measure antibody levels. So if you're interested in the study, you can call or text me. My number is on the screen, or you can email our study email at sncovidcommunity1@gmail.com.
All right, thank you, Sarah. And we will open it up for questions. Katie, do we have any questions that have come in by any chance that anybody has responded to?
No, not at the moment.
Okay. Do you want us to wait a couple minutes or?
We can wait like a minute or so if you just kind of want to wrap up, do a closing, and then we'll see if there's any questions.
All right. I forgot to put my email address on here, but if anybody has any questions, you can definitely message us on Healthy Six Nay, message us on the live Six Nations. As well, my email address is sndrugstrategy@sixnations.ca if anybody had any questions or concerns about the vaccines for kids, as well as if you have any questions at all, we would be free to answer any of them.
We also have a brief evaluation that we'll put in the chat, and anyone who completes that will be entered into a draw to receive a gift bag. So if you're interested in that, feel free to fill out the evaluation.
All right. And with that, I guess we will close for the evening. So thank you so much, everybody, for listening to our webinar. And again, if you have any questions, feel free to just shoot us a message on here, or you can email me at snDrugStrategy@sixnations.ca. And have a great night, everybody. Thank you for taking the time to hear me talk, and have a great weekend and stay safe.